right now, and in just a few hours, Montgomery County Council will introduce a resolution declaring racism a public health crisis. Scientists now say racial segregation and discrimination have real consequences on health and health disparities. We saw that more than ever during this pandemic, with African Americans having the highest number of recorded cases and deaths. Council member Will Jawando joins us now this morning with more on this resolution that's being proposed. Good morning, Councilman. Good to see you.
Good morning. Good to see you, Angie.
So by declaring racism a public health emergency, what is this going to allow the county to do?
Well, two things. In your intro, you mentioned something that's very important. One, it will unambiguously connect the fact that racism is embedded in a systemic way in so many of the reasons why Black people, why people of color are dying. 1 in 4 people that have died from COVID in Montgomery County are Black, much higher than the proportion of our population. If you look at maternal health and mortality, Black women are 3 times more likely to die in childbirth, despite their education or access to health care. When we show up at the doctor, doctors are much more likely to not think we're sick. Think of Serena Williams. So again, it doesn't matter of your level of education or access to money. And certainly when you see in criminal justice and police, Black men in particular and women much more likely to die at the hands of police. So racism is embedded in each of those things, and it's literally killing us and leading to a much lower quality of life if we're fortunate enough to live through the interaction. And so connecting the racism that's been going on for 401 years to all of those outcomes and saying, one, that's why it's happening. It's not because we drink or because we don't eat well or we don't exercise. No, that's not the reason for the disparities. It's because racism is embedded in each system. That's an important point because many people don't know that. Second, it says this is an emergency. We must take action right now, and it lists 10 or so actions in this resolution. We have to have a plan in each of these areas, legislation, policy, budgetary changes to address this emergency, these health disparities, the segregation in our communities, the reason young Black children and Latino children have asthma at higher rates because they live in environmental communities that are not sustainable. And so it's a ton of things that are connected to it. Certainly police violence is one of the most pernicious and abhorrent forms of systemic racism that we're seeing now being protested, but we die in many ways, and we need to make that connection, and we need to have a plan of action, and that's what this resolution calls on us to do.
And that would lead me to my next question, because we know that that resolution is being proposed later this morning. Do you expect it to pass? And if it does, where do you start? Does it begin with the education and the training of your own staff there at the council?
It does, and thankfully, I'm really happy to work on a council where all of my colleagues I've spoken to over the last week are going to be supporting this resolution that I've drafted and put forward. So we'll be putting it forward as a full council, and so it'll be introduced today, and people will be able to comment over the next week. We'll vote on it on next Tuesday, and then next Tuesday, me along with council members Navarro, Rice, and Albernaz, we have a historic 4 members who are council members of color for the first time ever in Montgomery County. We're going to be introducing the first piece of legislation under this resolution responding to the police violence, and it will be a bill that changes the use of force standard and makes it higher for from reasonable to necessary for when police can use deadly force. It'll outlaw chokeholds and knees to the neck and head area. It will prohibit officers from being able to strike someone who's handcuffed, and it will require officers who witness an officer committing a crime or using excessive force to intervene. So that'll be the first bill that we push, but we're going to need to do much, much more in every area in a systemic way. We need to get police out of schools. We need to address health disparities. So we're going to be doing that in the coming months and years to come.
Councilmember Jawando, thank you so much. A lot for us to follow up on as well, and we surely will today after today's meeting. Thank you.
Thanks, Angie.